Regenerative therapies fall under two main categories for addressing or helping to address cancer. One would be sort of this concept of nudging those, taking stem cells, nudging them backwards along their embryonic pathway through a process called induced pluripotent stem cells, or iPSCs. And if you go to your web browser and type in iPSCs, anything that we're doing in the US at least, and other countries too, on the research side for cancer in stem cells is usually in that genre, where we take some little peptides, little growth factors in a petri dish, and we convince those cells that they're younger than they are, and they have more power, and there are a lot, and then you can rev up those cells and make them identify cancer and remove it. So that's a very labor intensive, a lot of steps, a lot of labs, and it's under research right now. And that's very interesting. The other broad topic is called immunotherapy, where we're jazzing up or taking advantage of some benefits of our immune system that aren't working as well. That's where the NK cell type of things come in. There are other things. There's something called CAR-T, C-A-R-T, which is where you basically create kind of a genetic, you engineer some cells of yours, T cells, immune cells, and you put a gene from your cancer. So you need some cancer tissue. So again, labor intensive, a lot of work in the lab. And you basically cause those cells to make those T cells to produce some cancer protein, and then your body has a better immune response against the cancer. So what I'm looking for is something more efficient. Being a clinical practitioner and a simple country neurosurgeon, I wanted to keep it simple. We're tapping into these natural killer cell exosomes, and exosomes are cell-to-cell signaling particles. It's a little bit of a membrane, growth factors, peptides, proteins, and in NK cells, some what we call lytic enzymes. So basically, if an NK cell encounters a cancer cell, it deploys these smaller, not that cells aren't small already, but even smaller, about 1,000 times smaller, these extracellular vesicles, these cell-to-cell communicators, thousands of them, go into the cancer cell. The cancer cell takes them in. If you remember your high school biology, through endocytosis, it takes in their parts and uses them. And then that cell, those enzymes, cause that cancer cell or that zombie cell to rupture, die, and its parts recycled, and it's out of the system. It doesn't harm normal tissue. And we've shown this in petri dish. We've shown this in animal models. It's both for circulating bloodborne cancers, and you can inject it into solid tumors. So
like a breast cancer patient could
a breast cancer under image guidance,
any tumor,
lymph node, liver, anything. And